All right, we want to welcome you to our final session in the business track for Envision 2020. As has become customary for this, we like to finish the day off with an open panel discussion. We'd like to thank our three volunteers for sitting on the panel today, and we'll let them introduce themselves here in just a second. But again, special thank you to Mark Wayne, Ryan Gellner, and our own Ben Carlsrud. Starting off a panel like this, you know, it's important for us first to level set so you understand where these three gentlemen are coming from, what their environment is like. Our topic for today, as much as maybe all of us don't want to keep talking about it, but it is going to be COVID and what we have learned from this pandemic. We again, may not want to keep talking about it. We want to be able to see the light at the end of the tunnel and know when we're going to get out of this. But I think that we could all agree also that we've certainly been in this long enough that it lends itself to some reflection so we can look back on what have we learned, what have we went through, where do we think this is going, what might we have changed. So really that's what we want to get out of this. But again, we think it's important to give you an idea, just in case some of our audience isn't familiar with the organizations that these gentlemen are coming from, kind of, you know, what they've come to experience, right? So you can understand maybe along the way why they're answering some of these questions a certain way. So we're going to jump through the hoop of some real quick introductions and also some quick questions, again, to set the stage, if you will. Ryan, I'm going to ask you to start off the introductions. Again, if you'd want to introduce yourself, but also give us an idea, again, for those that might not be familiar with the industry that you're working in, maybe the size of your organization in regards to the number of employees, as well as the number of locations, if you would.
Yeah, thank you. Yeah, my name is Ryan Gellner. I am the Executive Vice President of Technology and Project Management at Gate City Bank. So we have currently probably around 720 team members at Gate City. We have 43 locations. That is in North Dakota and then western Minnesota.
Perfect, thank you, Ryan. Mark, we'll toss it over to you next.
Sure, hi. Thanks for having me here today. My name is Mark Wayne, and I'm the Executive Vice President and Chief Information Officer at Altru Health System. And we have approximately 3,800 employees here. Of that 3,800, probably about 420 are providers of some type. And we provide services in Northeast North Dakota and Northwest Minnesota. We have 23 Altru-owned facilities, and we probably provide services in another 40 facilities throughout our region, either through nursing homes or critical access hospitals or other facilities that are up in this part of the country. We also, at Altru as a health system, we're about a $600 million operation.
Great, thank you both for that. Lastly, Ben?
Yeah.
Turn it over to you.
So Ben Carlsrud, President at Network Center. We're about roughly 85 employees, mainly in the North Dakota area, at least Fargo and Grand Forks as far as physical locations, and then a fair amount of remote employees working out of the Bismarck and St. Cloud area.
It's great, thank you. As everybody can see, you know, we have a pretty diverse set within the financial, healthcare, IT, service field, so we hope this is going to be a good discussion. A couple quick questions for you, Ben. Again, just to continue to set that stage, what was the highest number of employees that you've seen working from home during the pandemic?
So we had already had about 20% of our workforce outside of the building, and then, you know, early to mid-March when everything kind of went on, we sent probably about 90% of the rest of the staff home at that point in time. There was some, call it key leadership management positions that stayed in the building, but other than that, you could say probably about 90% went home at that point.
Okay, and how about the current percentage that's working from home?
Yeah, we're still at about 70%. We have a high water mark in the main facility in Fargo of what will allow into the building to, you know, practice social distancing, you know, foam in, foam out kind of things so we can get some things done. You know, we're cycling employees through, so it isn't always the same 20-ish, 25 folks coming through, but that's about the number that we have right now.
Great. Mark, toss it back to you for those same questions. What was the highest percentage of employees that were sent home during the pandemic?
Well, for us, I guess I'm going to answer this in a couple different ways. For us in healthcare, there was a point in time when we were told we couldn't do elective procedures. We also had the factor where patients were concerned about coming in because of COVID, so they weren't coming in to visit. So for us, during a couple months, in fact, I think it was May, we had probably 45% less revenue than what we normally do. And in April, it was probably about 25 to 30%. So during those periods of time, we were scaling our workforce kind of up and down to kind of meet the needs that we had here. And I would say probably 15 to 20% of our staff were not working at some point during that period of time when the volume was so low from our workload. Now, in terms of employees going home and working remotely, for the most part, that would only impact our support services, and still that was only a portion of the support services we have. As you can imagine, in healthcare, there's a supply chain need and needs for our laboratory staff, and so those folks still had to be present to be able to support the clinical folks that were here. But we probably went from 6 to 10% people in those support areas that ended up being moved home and then working from home.
And Mark, is that still kind of the current number that you would say also?
Yeah, exactly. What we found is that, and for us, we had a lot of leased space around the community here where we had people located in. And really prior to the pandemic, really our staff, when we'd asked them or approached them about working from home, they would really rather be in-house so that they were able to connect with their peers. Once COVID hit, all of a sudden everybody was really anxious to get home, and we've moved them home, and now they've really liked it. And we've really seen almost a productivity improvement because we don't have as many staff that have had to travel back and forth between buildings for some of the different meetings. They just realize, hey, we can use these tools that we have here and really accomplish the same thing. So yeah, we still have that 6 to 10% of our staff that are working remotely.
Yeah, and we'll get into some of that a little bit later also. How about specific to your IT department? What does that look like, or what does that look like currently as far as work from home?
I would say that probably 80% of our IT staff work from home now. And the ones that are here are really in kind of support roles that need to be kind of in that main campus, and folks that are kind of doing a lot more hands-on when you have to do setups of equipment and those kind of things. But otherwise, we can manage and do just about everything remotely. So those 80% that have went home, they have liked it. It's working for them, and it's working for us as well.
Good. Thank you for sharing. Ryan, how about at Gate City? What's the highest percentage of employees that were sent home during the pandemic?
So we'll go two different directions. So the corporate office, during the pandemic, we have had 100% of those team members working from home. Now, all of our lobbies or the offices per se, those were still open. So those team members, did not go home unless there was some specific needs, and then, we would let them, work from home. But on the corporate side, 100% were working from home.
And currently, is it the same?
So currently at the offices, it is right now is business as usual. On the corporate side, we probably have about 90% still working from home.
Okay, great. And how about specific to your IT department, lastly?
For the IT department, we probably have about 10% in the office, as we talk about like hands-on, so that if there's some equipment that needs to be changed out or worked on, that they'll be in the offices. But for the majority, they're all working from home.
Sure. Okay, great. We'll jump into Some bigger questions, if we will. First one being more on the business side. Ryan, we're actually going to stay with you to lead this one off. How prepared do you think your organization was heading into the pandemic?
We were fairly prepared for this. So let's go back onto our corporate side. I would say we already had about 70% of our team members that had the capability to work from home. So the biggest issue that we had at that time was to really to try to give them that office experience at home. So to give them the monitors, to get them the headsets, things like that. And then it was just then working on with that 30% on giving them, you know, the equipment to be able to work from home. But we all of our corporate office, they were all moved at home with all the equipment they need within 1 week.
Okay, great.
And then just add on to that. So, you know, so as part of the financial institution, and so we do, you know, yearly disaster recovery tests. We you know, go through scenarios like this with our team members. So this is something that we do on a yearly basis.
Great. Ben, toss it over to you. Same question. How prepared was our organization heading into the pandemic?
Yeah, so being a technology provider, it kind of facilitated some of those things. Being that we work with a large number of regulated industries, we had to have a pandemic policy put in place probably a decade ago, which would have been a little more difficult to accomplish what we can do today with cloudy types of things. So literally picking up the laptop and heading home, that was already kind of pervasive through it, whether it was we knew a snowstorm was coming. We already had, you know, upwards of 20% of the workforce already leveraging the tools that we needed to do from home anyway. Maybe a little bit more shock to the system, and it's probably synonymous across the other industries as well, is, you know, we had users that weren't necessarily used to working from home. Now you go home, and then it's kind of learning out how do you structure your day with those tools, and how do you stay, you know, engaged. But from the standpoint of picking up and making it happen, it was pretty synonymous, because Sunday, you know, before Governor Burgum made the call to shut down schools, we'd already sent the notice out that if you didn't want to come in, because a lot of nervousness, right, unknown, fear, we'd already sent probably 80% of the workforce home at that point in time. And then by Wednesday morning, it was like, okay, we got stuff going on. We can do what we need to do. We had enough individuals that were willing to go on site to our customers and still perform those kind of things, because you still need feet on the street, hands, essential service. So it was pretty seamless for the most part.
Right. Mark, I think everyone's anticipating your answer on this, or anxious for it, being in the healthcare side of things. What do you say to the question, how prepared was Altru heading into this pandemic? And you can speak to it both from the healthcare side of things, but also then from the IT side of things within your organization, if you would.
You know, unfortunately, I guess at Altru and up here in Grand Forks, we've had a lot of experience to crises that have came about. And in my career, and I've worked for the organization for 35 years, in 1997, the whole city flooded, and we had to relocate and figure out how to continue to maintain care for our patients and get them to the right places, and get our staff located in areas so that they could continue to provide care and see patients. In 2017, we had a structural failure in our main clinic that's 140,000 square feet, and we had to evacuate the building, and we had to figure out how we could continue to provide care to our patients in the community. And we had that operational, I think it was on late in the week, and that following week we had everything squared around and we had people being seen again. So we really weren't able to, I mean, we really didn't miss out on taking care of the patients that we needed to. The pandemic really wasn't any different than that. Fortunately, similar to what Ryan had stated, we had technology in place. We've been real strong in telemedicine for years. We had our virtual platform all ready to roll, and we've been doing a little bit of that, just ready to really push it out. Up to that point, we struggled a little bit with trying to convince a lot of our staff that really the virtual way is the way we should go. Once COVID hit, everybody was asking for it because everybody wanted that access. So for us to be able to roll it out, it was very quick because we had all of that technology available. We had to do a little bit of training for some folks, but it's pretty straightforward, so it went real easy. So we were able to continue to see patients even though they didn't want to come into a facility. We could continue to see patients. From a command center structure, we, also being from North Dakota, we're used to those winter storms that are shutting you down and trying to figure out what you're going to do for care when you have these massive storms coming into play. So our command center ramped up right away, and I think within 48 hours, we had our curbside testing and our COVID hotline up and running. And we have a really good relationship with this upper region here, with all of the facilities that are up in this area. And so we had great collaboration between the local and state authorities as we were setting all that up. And we had regular touch points with all of these smaller facilities and communities around the area as we were going through the pandemic in those early stages. I think one thing that we're really proud of is that we never ran out of the supplies that we needed, and supplies were tough to find. And from a logistics standpoint, our staff just did an excellent job with that, with maintaining the necessary supplies that we had here, that we had to use for the care of the patients.
Well, thank you. I don't think anyone can argue that the challenges that the healthcare space went through, is going through, has been huge, and we certainly thank all of you for that, as well as anyone else in the audience in that space that's going through that. Keep up the good fight with that. It sounds like you've seen an awful lot in your years there, and that you're ready for pretty much anything that comes at you. So kudos to you, to your organization, as well as everybody else in the healthcare space. Thank you. We'll encourage the audience too. I forgot to mention this in the beginning. Please submit questions for these gentlemen. We will allow time at the end to take those for sure. So encourage you to do that early and often. We'll get to as many as we can. Ben, next question. I'll let you lead off. What, if you could put your finger on, what do you think the two main challenges were that came with this?
So collaboration has been a bit of a challenge, communication. We were a bunch of people in a building once upon a time, and it was really easy to, hey, I need to get a hold of this person. I'm just going to walk over to their desk and get 3 or 4 or 5 people in a room and kind of hammer that out. That has definitely been a bit more of a challenge because now you're checking jelly beans, or I need to schedule a meeting, or, I mean, the tools are, they're pervasive. They're part of our DNA, so to speak. But getting some of those kind of things has definitely been a little bit of a challenge. And then I think pre-COVID, work from home individuals had a pretty set routine, right? Like 8 o'clock, dress this way, whatever, all of those kind of things. And then, all of a sudden, wham, now we got to ship everybody home, and trying to manage the dynamics with family, noisy dogs, like John Bradmeyer said a little bit later or earlier, just some of those kind of things, and kind of readjusting to what the new workday kind of looks like from that standpoint.
Yeah, it's certainly been a learning experience for everyone. Ryan, back to you with that. You guys are obviously more spread out to begin with than we were at Network Center. With the majority of us being in one building, like Ben said, it's easy to walk over and talk to somebody if they happen to be in that building and get answers. What did you see, if you could, as the two main challenges with this?
Yeah, I would say probably the biggest challenge right now, or was really doing the troubleshooting for all of a sudden 300 team members at home. Okay, is it an issue with their internet provider? Is it an issue with our equipment? Is it, so, and then really having that empathy for that team member that, has never worked from home, and they're anxious, especially right away, of, what was going on. And it's like Ben alluded to, all of a sudden, their kids are at home, they're having to help them with school, and then they're trying to, work on top of it. So to really, support those team members, I would say that was a little bit of a challenge right away. On the collaboration piece, and which is funny, and that's for the bank. I don't know if it's really a challenge, but I think we have more collaboration now than we used to. And I'm just going to give, my department for an example. We would be sitting right next to each other, and team members, they might not even talk to each other. And now with the collaboration tools, they're, maybe having something of the word of the day, and they're having conversations on that throughout the day. So that there, I think, has helped the bank, is becoming more collaborate together.
Great. And to your first point, we certainly felt that as well at Network Center, the challenge of transitioning folks home, right? And it wasn't just internal for us, the challenge of transitioning so many of our customers, their employees to home, was huge, and a difficult situation, one that you figure out how to navigate along the way and get through it the best that we can. Mark, anything different along those lines with that question in regards to the challenges that you faced?
Well, for us, it was early on, as I mentioned, with that reduction in the revenue that was coming in because patients weren't coming in because we had to suspend all the elective procedures. It just created some real challenges. We had to look at, okay, what service lines are we going to maintain? We had patients that didn't want to come in. We had then patients that thought they had COVID that wanted to come in. We didn't want them coming into, all of the facilities where they might expose other people. So we had to kind of coordinate that and make sure you had the areas and getting patients routed to the appropriate place initially and getting them used to the COVID hotline and using that and some of our online tools. And then as the pandemic wore on, and we started to realize, here in our area with people with COVID and people that have been exposed to somebody with COVID, then it starts impacting from the staffing side. And right now, the entire state is just getting hit hard with COVID, and the hospitals are full all over. And as a result of that, because the communities are so full of COVID, a lot of our healthcare workers are either getting COVID themselves or they're exposed to somebody with COVID, which has mean that we don't have those folks coming in to work for us. So at the same time, you've got this full hospital, you have less staff available that you can draw on to do that. And so that's just created challenges for us. And fortunately, we've got, staff in other departments where, nursing or clinical staff have moved from the clinical area to the support area, and we can kind of draw on the staff that we have in these other areas to kind of backfill and help support some of those needs that we have. But, as I mentioned earlier with that reduction in revenue early on this, hospitals in general typically will only have a margin between 0 and 3%, the majority of the hospitals in the country. There's a few segment of them that are going to hit up over that. So when you have that thin a margin and then you look at 50% of your revenue in a month or two is all of a sudden gone, it creates some real challenges for the organization because you have to be able to continue to provide care for your community. And I can tell everybody we've been able to do that. It's tough and it's painful as you've had to go through and kind of reduce hours and make some of these changes along the way. But we have been able to successfully do this where now we're looking at the end of the year having a profitable bottom line, where early on we were thinking, geez, we could be down 65 million by the end of the year. So there were just a lot of decisions that had to be made along the way that aren't easy ones, but decisions that you do have to make.
Yeah, there's no doubt that this has caused all of us to be, I guess, more creative and agile in what we're doing, and certainly in no industry more than healthcare. Mark, stick with you on the next one. We're going to flip a little bit more to the IT side of things. Can you talk to us about what systems, software you might have implemented to help you get through the situation, or anything that you might be looking at to do that?
For us, we didn't really roll out anything new. We just probably took better advantage of the tools we already had. We have the Microsoft platform, and we just really started to leverage all the collaboration capabilities in that. And also with all of the meetings and people at home, and even if they're not at home, people weren't coming to face-to-face meetings anymore. We were doing it all through Microsoft Teams, and that's worked really well for us. And also, I think we just really, as I mentioned, we had all of the tools in place for our virtual connections with our patients, but we just had to ramp that up really quick. And we've also provided that kind of support out to our region. So we also provide hosting to 14 non-owned Altru facilities for their electronic medical record system. And so we were also at the same time trying to provide those virtual tools to those areas as well. We had a lot of needs for providers to be able to connect up with nursing home patients that they didn't have that virtual connection in place before, and so we were setting that up and trying to get that up and running for them, and it's all worked really well for us. I think just going forward, what we're doing is we're focusing more on leveraging the technology that we have, and anything that we can do that's going to make that patient experience better from that virtual standpoint, we're really looking at pushing those tools out there and getting those in place.
Okay. Ryan, how about on your side? Anything that you'd want to share with the group of system software that you've implemented since we got into this, or things that you're looking at?
Yeah, so kind of taking off of what Mark said, we were fairly prepared. We didn't have to actually purchase any new software, but what we did do is really rely on the technology we had, and especially on that Office 365 and Microsoft Teams, the collaboration piece. That was huge, because for the most part, when we were in the offices, we would have go to the conference rooms and have our meetings, or you would just have like a huge video conference where everybody's in one room and someone else is in another room. So really utilizing the Teams, the Office 365 on that collaboration piece. Things that we'll continue to look at, of course, is anything on the information security side, because even after the pandemic, we'll say, is over and we have team members coming back into work, there is still going to be a workforce that's going to stay at home. So we need to make sure that we have that, that information, that security posture in place. But the other thing too that we'll continue to look at is not really on the back end IT, but for our customers on that digital aspect, on what can we do to really enhance that customer experience for our customers on the front end side, as they're moving more into that digital aspect of banking.
Yeah, for sure. When we look at the financial industry, right? I've been at Network Center for, let's just say, a lot of years, and worked in the financial space for a number of those years. I can't imagine what this would have been like if this had taken place 15 years ago, 20 years ago, before all of the online types of platforms that were there, and when everybody actually went into the brick and mortar to do their financial business, right? So certainly some of the strides that industry has made over the last decade has lent itself well into a situation like this, and it would have been way more difficult to do would we have not have been in that situation. So, Ben,
yeah,
how about
I agree with that. And the funny thing is even during the pandemic, and so right away we did close our lobbies, but we kept our drive up open. And we still had a lot of customers that came to that drive up, and we would open up accounts for them, during, and through our drive up. So
really?
Yes, yep. So even, customers that didn't utilize the digital side, they still came, and we would open up the accounts through the drive up. So we can do it any way that a customer needs to. We would accommodate.
Old habits are hard to break, right?
They are.
Ben, how about at Network Center?
We're fortunate, right? Use the term that we eat our own dog food. So a lot of these tools that we're implementing for organizations such that are leveraging, I would say the only thing is we run into challenges internally about, okay, this group wants to use this type of collaboration tool and this group wants to use that type of collaboration group. So your meetings are like, okay, today I'm in a Microsoft Teams meeting, the next one I'm in a Cisco WebEx meeting, and then maybe I'm in a Zoom meeting, and then it's like, okay, where's the mute button, or how do I do this, or that kind of stuff. But yeah, for the most part, it was already in play. And to your point, like 10 years ago, it would have been way more difficult because all of this stuff was on-prem type of solution at that point in time, and fat clients and all of that kind of jazz. So pretty okay. And then to tail off of what Ryan said, we're always looking at the security aspect of it, right? Because especially when you have home users, is it the same network as the kids that are gaming or they're doing their school stuff? And how do we kind of play that out and make sure we're protecting all of the assets as well?
Certainly lends itself to a different type of challenge. We're actually going to jump to a question from the audience here and jump off topic just a little bit. Question being, has anyone on the panel seen a shift in what they would consider their long-term work from home strategy and what that might look like? Ryan, can I throw that one at you first? So have you seen anything towards that side of things, right? What is that long-term strategy going to look like? Or have you even went into that discussion yet?
That's a great question. We talked about that. So usually, as a bank, we really kept our team members working at the offices. We may had, I think, maybe 2 or 3 team members that were permanently work from home. And because of the pandemic and because of the efficiencies that, we've seen from our team members working from home, we will continue with that for the ones that want to continue to work from home. So we've done surveys, we've asked our team members, and, we're probably looking at, out of our corporate office, maybe 80 to 90 that will be permanently, working from home. And that one, it saves really the bank, at the corporate office, the having to always juggle, change things around, adding cubicles and things like that. So there will be a cost savings on that piece. But yeah, so it was a change of mindset from the executive down on the work from home environment.
Yeah, for sure. Before this, right, you talked about that executive level. A lot of them didn't want anything to do with this, even when IT managers, us as a trusted vendor, might bring something like virtualization or remote connectivity to them. They really didn't want anything to do with it. But now that we're in the midst of it, it's here. We can see that it'll work. We found ways that it'll make it work. So it'll be interesting to see where it goes from there. Mark, how about on your organization? Has there been a lot of discussion around what that long-term work from home strategy might look like?
Yeah, we actually have a group that's been meeting on a regular basis regarding just the remote workers that we have, and really I think the plan is to continue to allow them to work from home. As I mentioned, in our case, a lot of our IT staff were in leased space that we have in the community. And so, as Ryan mentioned, there's an opportunity for us to reduce some expense for us and as we make that final move and have everybody there. So going forward, I think that's how it's going to be. Anywhere that we have that opportunity to do that with the staff, depending on the work that they're doing, we will allow them to work from home, and we're going to actually encourage it. It's kind of interesting. I personally had experienced COVID back in late September, and at that time, from our executive team and a lot of our leadership, nobody had COVID yet. And even though when we would meet, we were socially distancing and, we wear our mask and all that, it's kind of an eye opener because from a personal standpoint, I had exposed, of course, my wife. I had a son that when I first had my first symptom happened to be on my birthday. So we went out for supper and my wife and one of my sons came. So both of them ended up having to be quarantined. And so it just impacted all of their lives as well. Just like we've been hearing all the way along, but somehow, as you're going through the process, you're just not thinking about that. And so it kind of really opened everybody's eyes back at at Altru, the rest of the exec team, we do more virtual meetings every time we connect now, and a lot of people are just, they might be in the building in their office, but we just connect virtually. So I think it just made us be a little bit smarter about how we are conducting our business, especially since we had the tools in place to do it that way.
For sure. Quick follow-up question. You had mentioned in the beginning there that there was a separate group that had gotten together to discuss this. Was this a committee that was formed? And if so, where did that directive come from? And what does that makeup look like within your organization? Who's on it, right? What I guess I'm really curious on when did that start? Who initiated it? Who was called to be on that group?
Yeah, so I think it started between IT and HR. Both of those two areas had a lot of people that were in off-site facilities that were lease spaces. And as the risk of COVID and having people exposed to it we're becoming more aware of that. We just said, okay, we need to push people home, but we need to have some sort of committee that's going to kind of monitor this, kind of evaluate what's going to be needed for their work setup. We'd always had people, our coders had worked from home. When we used to have transcription folks, a lot of those worked from home. And so we had other people that were doing that, but not to the extent that we started to do with COVID. And so we started this committee. We had some people that were involved with ergonomics and our HR and IT, as I mentioned. And this group started meeting on a regular basis and just were evaluating the requests that were coming in to work from home, and then just making sure that HR was good with it, that IT could arrange all of the necessary technology that was needed and so forth.
Okay, good, thanks. Ben, you're on the spot.
Absolutely.
All of the employees are watching.
I know they're hoping for
what is Network's
a one-word answer.
Long-term work from home strategy?
Yeah, so what we're seeing, and if you follow what other industries are talking about, right? Like back in May, it was pervasive across everywhere. Like if you were in an industry that functioned well, yeah, we're going to do 100% work from home. We're going to get rid of all of our building space. Downtown metros are not going to have people and all of those kind of things, right? A lot of it is verticalization, and some of those thought leaders, so to speak, are kind of coming back around. I can see within our industry where certain positions work really, really well because they have a certain task is what we need to accomplish every day. And then the other side of it is other aspects of our business work significantly better when we're near each other, so to speak. So, services industries, because there's some studies out there that show administration, financial services, organizations that provide business level services to organizations, they figure about 86% of those will still be work from home. But then when you start trailing it down to other services industries or other types, it kind of trails off a little bit. So it isn't going to be just a one and done type of statement. It might be kind of a combination. Now, do I think everybody will be back in the office 100% of the time? No, that's absolutely not the case. But will there be some hybrid of, hey, we need you here Tuesday, Wednesday, Thursday, and you're going to do some other things or whatever that kind of looks like? Absolutely, from that aspect.
Sure. Well, again, I know that we all want it to end soon, but we don't know if we're ever going to get back to what is normal. I guess that leads us into what would be our final question for this panel. Ryan, I'll let you kick this one off. Pull out your crystal ball, right? What's this going to look like in 6 months or a year or 18 months? Is there going to be a normal? Do we get close to it? Right? Where do you see this going?
Yeah, I'm hoping within a year we have some sort of normality. I know there's some news out there now, of course, with the vaccine, with a 90% success rate. So hopefully that will push to have a little normalcy here sooner than later. On the financial side, I would say, we're looking at probably not till March before, we're going to bring team members back into the offices. We've always kind of taken a look at it, at a 3-month basis. And right now with, of course, the COVID rates going up, we just don't want to take the chance of, having the team members in and then have one department expose it to everybody and then take out a whole department, and then we're unable to support our customers. I think, kind of, we were talking about the whole work from home, and I think that the biggest concern, I think, on the permanent team members working from home is really embracing the culture of your business. When you have your team members working in the office and you're doing certain things, they're part of that culture. And then how to have those team members that will be permanently working from home, how do you keep that culture embedded in with them? So those are some things that we're working on, and how are we going to accomplish that for those team members that are going to be permanently working from home.
Right, and that culture is difficult, right? It certainly changes when everyone's remote. It's hard to stay on track with that and do events, those sorts of things that helps to build that culture. So I think that's a challenge that every organization, regardless of the industry, is going to be up against for sure for the foreseeable future. Mark, how about your crystal ball? What does that look like?
Well, I think that we will kind of continue the same approach that we've had up to this point. As Ryan talked about, even with the vaccine, it's going to take a number of months before they could ever get everybody vaccinated. And what I've been hearing is that the plan is to start looking at the most vulnerable and those with some sort of chronic illnesses. To try to get those addressed first, and then cover healthcare workers, and then kind of move on from there. But there's only so many vaccinations and doses that they can have available on a monthly basis. So we know it's going to be a period of time yet before we can collectively take a deep breath and think that, okay, we're over the hill now. So we have to continue to be diligent and careful, wearing our masks, social distancing, and taking all the precautions we can so that we can somehow get through this peak that we're feeling now, in which everybody is strapped with having enough staff to really take care of the patients in their facilities. We've got things in place, and we've all talked about it from the collaboration standpoint, and for us to be able to provide care virtually, and that will need to continue. A challenge that you have when all of a sudden you make that shift, as you kind of touched on, as you push, as everybody starts to work remotely, it's really keeping that culture in place and keeping those employees engaged. It always feels like it's a little bit easier when you can kind of walk down to the conference room and have a team of folks all in one room and you're visiting. And yeah, you can do it virtually, but there's something that just feels a little more, I don't know, it just feels like you're a little more connected when you can do it in person. And so we have to figure out the best way to continue to do those kind of things so that we can keep our staff engaged, because we've been real fortunate up in Grand Forks, and maybe it's because we're a little bit isolated. We tend to have staff that will stay for long careers, where when they start working remotely, if we aren't keeping them engaged like we have, then you run the risk that maybe you're going to lose some people through this process as well.
For sure. I think it'll be interesting to see, when we do finally get through this. Not that I'm saying that it'll ever return back to normal, especially in the healthcare space and when we go to seek healthcare, but just in general, when we do get back to what would be close to normal on the sensitivity that folks have with our normal interactions, right? Or what was normal before. Right? Is it still going to be acceptable to gather in large groups, or are people going to be standoffish when they're doing that? And how long is it going to take for that to maybe go away? Like you said, all of that lends itself in our personal lives, but also in our work lives when we talk about that culture and building that. So it'll be interesting. Ben?
Yeah.
How about your crystal ball?
Kind of mirror what the other gentleman said. This is not going away anytime soon. Be sensitive, accountable, responsible to our team members. To mirror the culture statement. I'm a people person and need people in the office, and it's wicked lonely there right now. It's quiet. The laughing and that kind of stuff. There's a little bit of it because we have some of that. Individuals in the building, but Otherwise, certain areas are ghost towns, right? And it's kind of, it's a little bit depressing sometimes. But we're not going to make any rash changes or anything like that. I know a lot of the organizations that we serve, they've brought back a fair amount of their employees back into the building, and now they're going to have to readjust based on what numbers are doing and levels and that kind of stuff. You know, so, you know, 6 months out, 12 months out, you know, until this thing gets under control, we're going to continue doing what we're doing. But to continue to learn on how the next time this happens, because this has always been something that's on a different show or it's in a movie or something like that, you know, and now it's here. And with the proliferation of being able to move around and all these kind of stuff, I mean, flights aren't new, right? But this, you know, looking at studies from like Wall Street Journal, you know, they showed where this was actually on our shores, you know, early January, and they showed that it was actually peaking up like mid-February, but there weren't a lot of symptomatic people out there. So it's kind of crazy how this stuff moves around, right? So, you know, learn our lessons on this one, be better when the next time it happens, because I'm sure it is.
Yeah, unfortunately, it probably will, as much as we all hope that it won't. So, well, gentlemen, I want to thank you for being a part of this panel discussion. We certainly hope for the audience that it was worth hearing these three different set of experiences, points of view, and whatnot. We hope you gained something that you can take back to your organization. So again, Ryan, Mark, Ben, thank you for joining our panel to conclude the track here on Envision 2020. At this time, we're going to turn it over to Brad Gorder here in just a second. He has a couple of giveaways to do, as well as put a wrap on Envision 2020. So again, thank you all for joining. Panelists, thank you for being a part. Have a great day.